Okay, so can you see the slides?
Yes, doctor.
Yeah, so this I have already sent it to you. This is all about the anatomy of the lower limb. Actually, it's a very big topic, but we try to make it simple for you, and so that you can concentrate on what are the things which you have to know in the structure of the lower limb. So what are your resources for the lower limb? First, we have given you three gates, and the one gate I will send it to you today, inshallah. This is about the joints. So you have to read from these four gates, gate 1, 2, 3, 4, and then this presentation, which is about 25 or 26 slides, and then your workbook of uh, anatomy. So read your lower limb from only these resources. This will be enough for you, inshallah. So what we have to know in this tutorial, most of the thing you have already discussed because you have already finished gate 1, 2, 3. So you know most of the things. So what is the objective? What are the objectives of this tutorial? So first and foremost is that you have to know about the bones and the joints of the lower limb. So what are the bones and a different part of the lower limb that you have to know? Then the muscle group of the lower limb. Like say, what do you mean by the muscle group? Like we have so many regions, like we have the gluteal region, then we have the thigh, leg, and the foot. So you have to know about these muscles group. What are the names of the muscles, their nerve supply, their action. So this you have to know, not individual origin and insertion, but again I'm repeating, you have to know the bony points. Then last thing what you have to know is about the major vessels, which include the arteries and the veins and the nerves of the lower limb. So this is what you have to know in this, you know, uh, the anatomy of the lower limb. So let's start with the bones. Okay. So one of you have just mentioned that do you have to know about the hip bones? So hip bones, actually we are just keeping it for the origin and insertion of some muscles of the lower limb. So this is what you have to know. So uh, you will just now you will come across some of the muscles that gets origin from the hip bones. So that is only we have to know. So this you have already read it. I'll just go through this and so that you can just revise the things. So it has the hip bone has three parts. The medial part is the pubis with the superior and inferior ramus. So this you have to know why, because the medial part of this hip bone gives origin to the medial muscles of the thigh. This we are going to shortly know about what are the medial muscles of the thigh. So if it is asked, what what are the muscles which are attached to the pubis, you can simply say the muscles of the medial compartment of the thigh. All the medial compartment will take origin from the medial part of the bone, medial part of the hip bone, and that is the pubis. When I say pubis, it has two ramus, superior inferior ramus. So even if you say the pubis, we'll accept your answer. So the medial muscles, the origin is the pubis. This is the medial part of the bone. So the medial part of the bone will give origin to the medial muscles of the thigh. So that's why we have included the hip bone only for the origin and insertion purpose. This you have already read about it. So this is the pubis. Then we have another important bony landmark of the hip bone, and that is called ischial tuberosity. This you can see it from the behind. This is the anterior view, and this is the posterior view. So the first part is, just make note of it. First part is the pubis, which is the medial hip bone of the hip bone, medial part of the hip bone, and it gives origin to the medial muscles of the thigh. In thigh, we have how many compartment? We have three compartment. We have the medial compartment, we have anterior compartment, and we have the posterior compartment. So the medial compartment muscle, the origin is the pubic bone. If you say like this, we'll accept it. Okay. Now, so this is the medial compartment. Then we have the posterior compartment. Now let's go to the hip bone again. So this is the medial part of the hip bone, the pubis. Then the posterior part of the hip bone, we have two parts. This is from the posterior. You can see this is the posterolateral or the outer surface of the iliac bone, and this is the ischial tuberosity. So in the posterior part, we have divided into two parts further. One is your posterolateral, or you can say outer surface of the iliac. This is the third part of this bone, and then the ischial tuberosity. So altogether, the hip bone is having three parts. The medial part is called pubic bone. The upper part is called iliac bone, and the posterior part is called ischial tuberosity. The iliac bone again, which is the uppermost part, is having two parts. One is called outer part and one is called inner part. So from posterior, when you look it at from the posterior side, you will see two parts: the outer side, the outer part of the iliac bone, as well as the ischial tuberosity. Okay. So now they'll ask you about this ischial tuberosity. So all of you have to identify the ischial tuberosity. And the next question will be name the muscles which are attached to the ischial tuberosity. So again, coming back to the thigh, it has three muscle compartment: the medial compartment, the posterior compartment, and the anterior compartment. So the medial compartment muscle will take origin from the medial part of the bone. The posterior part, the posterior compartment muscle will take origin from the ischial tuberosity. So remember this. Again, I'm coming to this. The hip bone has three parts. The hip bone has three parts. You can see the slides or not?
No, doctor.
You cannot see? Okay. Give me a minute. Okay. Can you see it now?
Yes, we can.
Yeah. Thank you very much. Okay. So the thigh is having three compartments: the medial compartment, the posterior compartment, and the anterior compartment. The medial compartment muscle will take origin from the medial part of the hip bone, which is the pubis. The posterior compartment of the thigh will take origin from posterior part of the hip bone, and that is ischial tuberosity. So they'll ask you how they're going to ask you. They'll give you the hip bone and they'll mark the pubis or the ischial tuberosity. Similarly, in your MEQ exam, they'll ask you name three muscles which are attached to the ischial tuberosity, or name three muscles which are attached to the pubic bone. So if they'll ask you like this, what you have to answer? You have to answer the muscles of the medial compartment, and for ischial tuberosity, you have to answer the muscles of the posterior compartment that will come. So we have three compartments. We have finished with the medial compartment and the posterior compartment. For the hip bone, you have to know the medial part of the bone as well as the posterior part of the bone. Okay. Now, coming to the iliac bone, which has two parts: the outer part, which you can see from the posterior view, and the anterior part or the inner part, which you can see from the anterior view. Now, let's see it from the behind. So you can see the ischial tuberosity, and just above the ischial tuberosity, we have the outer surface of the iliac bone. You can say the outer surface, or you can say the posterolateral surface. Both are correct. So which muscles are attached to this posterolateral surface? Now, how many compartment? Again, go back to the compartment. How many compartment do we have in the thigh? We have three compartment: the medial compartment, the posterior compartment, and the anterior compartment. Now, whatever you can see here is the posterior compartment of the thigh, and just above the posterior compartment of the thigh, we have the gluteal region. Okay, so the posterior compartment muscle will take origin from ischial tuberosity. Which compartment muscle will take origin from the posterolateral surface or the outer surface? This is the gluteal muscles. So we have how many gluteal muscle? We have gluteus maximus, medius, minimus, and tensor fasciae lata. And all of them, they'll take origin from the outer surface with iliac crest. The iliac crest is also there. The outer surface of the iliac bone with the iliac crest. So this is the origin of the gluteal muscles. So now we have three regions in the thigh with one gluteal region. Where is the gluteal region? Just above the posterior compartment of the thigh. So the posterior compartment of the thigh will take origin from the ischial tuberosity. So what about the gluteal muscle? They'll take origin from the bone which is above the ischial tuberosity. And what is the bone? That is the outer surface of the iliac bone. That is we call as posterolateral surface or the outer surface. Okay. Now coming to anterior compartment. What is this bone is? What this is the femur. Now in hip bone, if you see the hip bone, this is the iliac and this is the anterior part and this is the posterior part of the iliac bone. So this you can see this is the inner surface. If this is outer surface of the hip bone, this is the inner surface or anteromedial surface. So this is one of the this we can see it from the anterior. So the anterior compartment muscle will take origin from this anteromedial surface. Okay, or the inner surface of the iliac bone. And what is the muscle here which is taking origin from the whole of the iliac bone? This is called iliacus. The name itself suggests that it is taking origin from the iliacus. So they'll ask you this muscle. What is this muscle is? This muscle is a very broad muscle that you can identify. This is iliacus. And then we have two bony prominence here in the iliac. One is called anterior superior iliac spine and one is called anterior inferior iliac spine. These are again two important bony landmarks. Whatever I'm repeating, these are important bony landmarks. I'll come again. So what muscle do we have here from anterior superior? We have another, which compartment muscle will take origin from here? Anterior compartment. You can, because it is anterior superior and this is anterior inferior, which you can see from anterior. So the muscle which will take origin from here will go anterior, not posterior. So this is for another anterior compartment muscle that is called sartorius. So it's very important to identify this bony landmark. This is anterior superior iliac spine. So they'll give you the hip bone and they'll ask you identify this bony landmark. So you have to say this is anterior superior iliac spine. The next question will be what structures are attached to this? We have two important structures. One is your muscle of the anterior compartment, that is sartorius. This sartorius is attached to the anterior superior iliac spine. And then another important structure is your ligament, which is running from the pubic tubercle to anterior superior iliac spine, and that is called inguinal ligament because this region is the inguinal region. So this is another important bony landmark in the hip bone. The next bony landmark just inferior to the superior iliac spine, and this we call as anterior inferior iliac spine. And we have origin of another muscle here that will come, to, later to know what are the muscles here in the anterior compartment. So what are now again we'll go back and we'll see what are the important bony landmarks in the hip bone. The pubis first. They'll ask you about the body of the pubis, superior inferior ramus. For the minor movement, just remember the pubis. This is the medial part of the bone. So they'll ask you to identify this bony landmark and they'll ask you to name few muscles which are attached to the pubic bone. So all the medial muscles, all the medial compartment muscles, see this is the medial compartment. So all the medial compartment muscle will take origin from this pubic bone. So this is the one landmark. What is another landmark? The ischial tuberosity. Again, you have to identify the ischial tuberosity. Where is the ischial tuberosity? What muscles are attached to the ischial tuberosity? Muscles of the posterior compartment of the thigh. In the thigh, again, we have three regions: the medial compartment, posterior compartment, and the anterior compartment. So this is the another important bony landmark. What are the others? This is outer surface or the posterolateral surface of the iliac bone. What are the muscles here? We have the gluteus muscles, gluteus maximus, medius, minimus, and tensor fascia lata. These all muscles are attached to the posterolateral surface along with the iliac crest. Okay, now this is if this is outer surface, this is the posterior view. So whatever you are saying is the outer surface. This is the inner surface. Simply say inner surface or anteromedial surface. Which muscle is attached to this all iliac fossa? This is iliacus. This is iliacus here. They'll ask you where is the attachment of the iliacus? So this is the surface. Then we have two important spine, anterior superior, anterior inferior iliac spine. So this is what they are going to ask you from the hip bone. This you have to know. Now let's go to the femur. This is the proper bone of the lower limb. So you have to know about the femur itself, how to identify the site first. The femur is like your humerus of the upper limb. So it's a long bone. It has two end, upper end and the lower end. Upper end is called head, connected to shaft by the neck. And anteriorly we have intertrochanteric line, and posteriorly we have the intertrochanteric crest. Crest is posterior and the line is anterior. And then this is the shaft. And at the top of the shaft, we have two trochanter. One is called greater trochanter and one is called lesser trochanter. Then this is the shaft. And at the lower end, we have two condyle. This is lateral and medial condyle, and in between the two condyle, we have the intercondylar fossa. Now, in the shaft there is a neck, and anteriorly there is a there is an intertrochanteric line, and posteriorly there is intertrochanteric crest. Now look at the shaft. Anteriorly, you will not able to see any or appreciate any borders because this is all flat. But posteriorly, you can see is one prominent border, and this prominent border is called linea aspera. It has two lip. It has two lip, the medial lip as well as the lateral lip. This will come to know later what are the structure attached to the linea aspera. And then at the bottom, we have two condyle, medial condyle and lateral condyle. And then when you follow the medial condyle, just above the medial condyle, we have one tubercle. And this tubercle is called adductor tubercle. This is on the medial side. So remember, the medial side muscles are coming here. This area is for the medial muscles. And on the medial supracondylar line, we have one tubercle. This is called adductor tubercle. Again, this is an important bony landmark. So what are the bony landmarks here on the femur? First of all, you have to identify the bones, identify the site, and you might be, you have to explain why it is the right side or why it is the left side. Then the important structure, head, neck, and then these two trochanter, the greater trochanter and the lesser trochanter, you have to identify, and you have to name the structures which are attached to this, like say lesser trochanter. Lesser trochanter is for attachment of the muscles of the anterior compartment, and one of them is the iliacus muscle. And another muscle which is coming to the anterior compartment is the muscle of the posterior compartment of the abdomen, and that is called psoas muscle, psoas major. So this psoas major is coming medially, and iliacus is coming from the laterally, and then these two muscles get attached to the lesser trochanter, and these two muscles are called iliopsoas. So this bony prominent is very important, the lesser trochanter. So that you have to identify the lesser trochanter as well as you have to name the structure which is attached to the lesser trochanter, and that is the iliopsoas. So what are the bony points here? Greater trochanter, lesser trochanter, the linea aspera, and then posteriorly you can see the gluteal tuberosity. What structure will be attached to the gluteal tuberosities? Now see this. This is your gluteal region, and here is the attachment of the gluteus muscle. So this gluteus muscle will come, the maximus will come posteriorly, from posterior to posterior. This is the posterior view. So it will come from the posterior surface of the iliac bone to the gluteal tuberosity, and this is gluteus maximus. So remember this important point because they'll ask you the action. So what is the action of this gluteus muscle? It is coming from posterior to posterior. It is passing posterior to the joint. So the main action of this muscle will be the extension. And then from here, the gluteus medius and minimus is coming and it is attached to the greater trochanter on the lateral surface. So these two muscles, gluteus medius and minimus, will do what? Abduction. So this is This is their action. This is coming posterior to posterior, so this is extension. This is coming from lateral to lateral, so this is abduction. And adduction will be done by all the muscle which is on the medial side, the adductor muscles. Okay, let me ask you one question. There is a muscle called adductor adductor longus, or say adductor magnus and adductor brevis, the adductor magnus. What is the origin of the adductor magnus? This is the pubic bone. Okay, this is from the medial side. And then where is the insertion? This is on the adductor tubercle. So from the medial to the medial side. And what is the nerve supply? That will come. All the medial muscles are supplied by the obturator nerve. Now see this obturator foramen here. And from this obturator foramen, there is a nerve coming that is called obturator nerve. So this bone on the medial side is for the medial muscles. This nerve which is on the medial side is for the medial muscle, and the medial muscle, the action is adduction. This is how you should approach. So all the medial muscles are supplied by obturator nerve. The origin is, where is the origin? On the pubic bone. Insertion, where is the insertion now? Now see this. This is the linea aspera and it has two lip, the medial lip and the lateral lip. So the medial muscle will take insertion on the medial lip of the linea aspera as well as the adductor tubercle. So they are going to ask you about the adductor tubercle, identify the adductor tubercle, and they name the muscle which is attached to the adductor tubercle. So this is about your femur. Now let's go to the leg. In the leg, we have two bones. One is the medial bone, which is called tibia, and one is the lateral bone, which is called fibula. Tibia again is a long bone, which is having two condyle, lateral and medial condyle. Then there is a shaft, and at the lower end, medial side, there is the medial side is expanded to form the medial condyle. It has one anterior sharp border, and then we have two surface, the medial surface and the lateral surface. And on the top, just below the two condyle and in intercondylar eminence, below there is a tuberosity. This is called tuberosity of the tibia. And this is for the attachment of which compartment muscle? The anterior compartment muscle. This we are going to learn about what are the anterior compartment muscle. Here we have the attachment of the very important anterior compartment muscle that is called quadriceps femoris. So this is the attachment of the quadriceps femoris muscle. This is anterior. This is the anterior view. We have two surface, the medial surface and the lateral surface. Now the medial surface you can see is subcutaneous. There is no attachment on the medial surface except on the upper part. Here we have attachment of the three muscles. So they'll give you this bone. They'll give you this bone and they'll mark this area. They'll mark this area. What is this area? Is upper part of the medial surface of the tibia. This all is subcutaneous except the upper part. So now they'll ask you what muscles are attached on this area, the upper part of the medial surface of the shaft of the tibia. And here we have attachment of three muscle, each muscle from each compartment of the thigh. So in the thigh, we have three compartments. So one muscle is from the anterior compartment, that is sartorius, that I have told you. The origin of the sartorius is on the anterior superior iliac spine, and the insertion is here on the medial uh, and the medial shaft of the tibia. One muscle is from the medial compartment, that is called gracilis, and one muscle is from the posterior compartment, that is called semitendinosus. So we have insertion of three muscle here. This is the lateral surface, and this is the interosseous border. The posterior side, you can see the posterior surface, which is between the medial and the lateral border. And on the upper part, we have one line. This is called the soleal line. Again, this is for attachment of the muscle. The fibula again is a long bone. It's having the head, the shaft, and the lower end, which is expanded to form the lateral malleolus. So the medial malleolus is a part of the tibia. Lateral malleolus is a part of the fibula. The head here and the top of the head is called sterloid process, and this gives attachment to the lateral compartment of the muscle that is called biceps femoris. So they'll ask you what muscle is attached to the head of the fibula. So you have to say this is biceps femoris. And then just below the head, we have the neck. And one very important nerve is related to the neck, and that is common peroneal or the common fibular nerve. So if this side is damaged, your common fibular will be damaged. and the common fibular divide into the deep peroneal or the superficial peroneal. The deep peroneal supply the anterior compartment, and the superficial peroneal supply the lateral compartment of the leg. So these are the important bony landmarks of the bones of the leg. Next, we have the bones of the foot. How they are going to ask you? They'll give you this skeleton of the foot and they'll ask you to identify the muscles. So it's simple. You have to say this is the largest bone. This is called talus, and on the top of the talus, this is calcaneum, and on the top of the calcaneum we have talus. Just anterior to the talus is navicular, and anterior to navicular we have the three cuneiform: medial, intermediate, and lateral cuneiform. And just in front of the calcaneum we have the cuboid. So this is for the identification. If they'll give you, we have enough model for the bones of the foot, so you might get this as a bony skeleton, and you have to identify the bones of the foot. Then we have the metatarsal and the phalanges. But the tarsal, they are going to ask you identify the tarsal bone. So you have to name all these things. Now, in this tarsal bone, the calcaneum, on the posterior surface, we have a tubercle. This is called posterior tubercle of the calcaneum. And here we have attachment of the posterior compartment muscle of the leg. That is called Achilles tendon. That is for the muscles of the calf region that we are going to learn about what are the calf muscles. So here we have attachment of the calf muscle, the posterior tubercle of the calcaneum. Okay. Now, this you have already read. This is an important topic, arches of the foot. What are the arches we have? We have the medial longitudinal arch, lateral longitudinal arch, transverse arch. How this arch is formed, I'll just focus on that point. Now, how this arch is formed? Look at this arch here, and these look at these. The stones. These stones are you know all equal in shape from all the side. But if this, look at this stone, it is wedge shaped. So if it is not wedge shaped, it is all flat from the four side. You will have a flat, you will have a flat foot. But this stone is wedge shaped, and all these bones are attached to this wedge shaped bone, and then it's become the arch. So to form the arch, you have to have one bone which is like a wedge shaped. So because of this wedge shaped bone, there is going to formation of the arch. So this is the problem. If there is a bone which is not wedge shaped, or which is like a flat from the all side, you are ultimately going to have the flat foot. So for each arch, we are going to have a one wedge shaped bone that we call as keystone. So they'll ask you which bone is the keystone for medial longitudinal arch, or the lateral longitudinal arch, or the transverse arch. So let's say the transverse arch. This is the transverse arch, and this is formed by the cuneiform bone. Now look at the intermediate cuneiform bone. This intermediate cuneiform bone is a wedge-shaped bone. So these two bones, when attached to this, it's going to form the arch. Similarly, for medial longitudinal arch, look at the talus bone. This is one end and this is another end. So this is forming an arch. So whatever is bones attached to the talus here, it is forming the medial longitudinal arch. So the medial longitudinal arch, the key bone is the talus. For the transverse arch, the key bone is the intermediate cuneiform. And for the lateral longitudinal arch, the key bone is your cuboid. The shape of the cuboid is the wedge shaped. So whatever is attached, the calcaneum and lateral to metatarsal, they're forming the lateral longitudinal arch. Now, once the arch is formed, how you are going to maintain it? The formation of the arch is by the wedge shaped bone, but its maintenance is by some other factor. So this is an important question. Factor maintaining the arches of the foot. One is the shape of the bone. So we have a keystone for each arch. If there is no keystone, there is no formation of the arch. And then once the arch is formed, you need to tie it. So all the inferior edges of the bones are tied together with what? With the short and long plantar ligament. So you can see there is a small ligament that we used to call plantar ligament that they tie each bone together. And then you need to suspend it, suspend the arch from above. So what are the structures suspending it from above? We have long tendon. We have on the medial side tendon of flexor hallucis longus. This is suspending the medial longitudinal arch from above. Similarly, we have the peroneus longus tendon on the lateral side that is suspending the arch from the lateral side. So these are the factors maintaining the arch. I will also supply with you one additional resources for this, and you have to read about the factors maintaining the arch, how this arch is formed, what are the bones forming the arch, and how, what are the, factors maintaining these arches. Joints of the lower limb. This is very much similar to the joints of the upper limb. The first joint is your hip joint, which is a ball and socket joint. So what are the things we have to know in the joint? First of all, what type of joint it is. So what type of joint is the hip joint? It is a ball and socket synovial joint. The next question is about what are the structure forming the hip joint. So it is formed by the head of the femur and your acetabulum of the hip bone. The next thing you have to know about the ligament. So what are the ligaments here we have that you have to know. Now, look at this structure. This is acetabulum labrum. In the ball and socket joint, you will see to deepen the socket, there is a formation of labrum around the joint. So in upper limb, this we call as glenoid labrum, and in the lower limb, we call it as acetabulum labrum. And then there is one ligament coming from the head of the femur. This we call as ligament of the head of the femur. And then apart from these two, we have another three ligament coming from three part of the hip bone. One is from the ilium called iliofemoral ligament. One is from ischium, and one is from the pubic. We call it as ischiofemoral and pubofemoral ligament. The most important point, what you have to know is the movement. Ball and socket joint, all kind of movements are possible. We have abduction, we have adduction, we have flexion, we have extension. So all kind of movement is possible. Now tell me, now just concentrate on this. Adduction of the hip joint will be done by the medial muscles. The medial muscles are the adductor muscle. Their origin is from the pubic bone. So adductor magnus, longus, brevis, and gracilis. This all muscle will do what? The adduction. Abduction. I told you the gluteus medius and minimus from the lateral surface of the hip bone. It is coming to the lateral surface of the greater trochanter. So this is the lateral muscle. This will do what? This will do abduction. Okay, so adduction, abduction. The flexion will be done by the anterior muscle. What muscle is coming anterior? Iliacus from the iliac bone and psoas major from the posterior compartment of the abdomen. So iliopsoas is attached to the lesser trochanter. So this is passing anterior to the joint. So these are the main flexor of the hip joint. Extensor of the hip joint. Remember the posterolateral surface of the iliac. It has, the outer surface, and from the posterior we have one gluteus maximus. So the gluteus maximum is the main extensor of the hip joint. So these are the movement, and you have to know the muscles for each movement, the main muscles which are producing this movement here. Then we have the knee joint. How this knee joint is formed? The knee joint is formed by the lower end of the femur and upper end of the tibia. What in the lower end of the femur, we have medial and lateral condyle with the patella, and the medial and lateral condyle of the tibia. Now, what are the ligaments we have? We have two different kinds of ligament. This again, they're very fond of asking this question. What are the ligaments of the knee joint? It's a very complex compound joint, and it's a very, very important joint. So we have two different kinds of ligament here. Now capsule is attached to the margin, and we have some ligament which are outside the capsule, and we have some ligament which are inside the capsule. So we have four ligaments which are outside the capsule, and these are collateral. Collateral means which is on the lateral side of the joint. So we have two collateral ligament, one on the medial side, we call it as a medial collateral ligament, and one on the lateral side, we call as the lateral collateral ligament. One ligament passing from the patella to the tibial tuberosity, we call it a patellar ligament. And one ligament on the behind, this we call as oblique popliteal ligament. Now, behind of the knee is called popliteus. Remember this. We have one fossa behind the knee, and that is called popliteal fossa. So all the structure which are behind the knee, we call it as popliteus. So there is one oblique ligament that we call as oblique popliteal ligament. So we have four extra capsular ligament. They'll ask you in MEQ, name the extra capsular ligament. So you have to name medial collateral ligament, which is also called as tibial collateral ligament, the lateral collateral ligament, or also called as fibular collateral ligament. And then we have patellar ligament and oblique popliteal ligament. These are four extra capsular ligament. Now again, the knee joint is formed by lower end of the femur, upper end of the tibia and patella and posterior surface of the patella, not fibula. Remember, fibula is not forming the knee joint, but is it contributing to the strengthening of the joint? Yes. How? By the lateral collateral ligament. Remember, lateral collateral ligament is also called as fibular collateral ligament. So it is the attachment, it is giving attachment to the lateral collateral ligament. So this is how it is providing some strength to the knee joint, but actually it is not forming the knee joint. Knee joint is only formed by the femur, tibia, and the patella. Okay, so these are four extra capsular ligament, which is outside the capsule. And then we have four intracapsular ligament. Now there is a confusion. I just want to, uh, talk about this confusion. Now extracapsular structure, we have four. What are those? We have two cruciate ligament, and then we have two menisci. We have two menisci, the medial menisci and the lateral menisci, just to make it, to absorb shock in your joint. Now, these menisci are the fibrocartilage. These are the cartilage. These are not ligament. But still, some book like say Snell, they say these are intracapsular ligament. For all practical purpose, if it is asked in your exam, name the intracapsular ligament. You can also name this menisci, or these are intracapsular structure. These are actually not ligament, but some standard textbook follow this as a ligament. So we might include it. If you write it, it is not wrong. So intracapsular, we have four ligament, two cruciate ligament, anterior and posterior, and two menisci, the medial menisci and the lateral menisci. Now, these two ligaments are very, very important, the anterior and the anterior and the posterior cruciate ligament. The anterior cruciate ligament is attached to the anterior part of intercondylar area and of the tibia, and the posterior cruciate ligament is attached to the posterior part of the intercondylar area. So the name anterior and posterior is based on their attachment on the tibia. We call anterior as anterior because it is attached to the anterior part of the tibia, and posterior as posterior because it is attached to the posterior part of the tibia. Because if you follow the anterior cruciate ligament, it is passing from anterior to the posterior, and it is attached where? To the posterior part of the femur of the which part, which side of the medial surface of the lateral condyle of the femur. Similarly, if you follow the posterior cruciate ligament, it is passing from the posterior of the tibia to the anterior part of the lateral surface of the femur here. So we call it anterior and posterior because of their attachment on anterior and the posterior part of the tibia and not on the femur. So don't get confused. So they might ask you, where is the attachment of the anterior cruciate ligament? It is anterior on the tibia and the posterior cruciate ligament is posterior on the tibia. Where? In the intercondylar area. These are the two condyle and this intercondylar area. On this anterior part, we have the anterior cruciate ligament, and on the posterior part, it is the posterior cruciate ligament. What is the function of the anterior cruciate ligament? This prevent the anterior movement of the tibia on femur. So when you try to pull the anterior cruciate ligament anterior, it is prevented by the anterior cruciate ligament. Similarly, when you try to push the tibia posteriorly, it is prevented by the posterior cruciate ligament. So anterior prevent anterior movement of the tibia, and the posterior prevent the posterior movement of the tibia on femur. So this is from their attachment. So these are the main ligament, the intracapsular ligament and the extracapsular ligament. This is a modified hinge joint, and we have mainly two type of movement. One is called extension of the knee joint and one is called flexion of the knee joint. So you have to know, and you might be asked to demonstrate this movement in your exam. They'll ask you, please demonstrate on yourself the extension of the knee joint. So you have to know how to do this. Similarly, you have to know how to do the flexion of the knee joint. So extension and flexion is done by, like extension is done by the anterior compartment muscle. What is the anterior compartment muscle here? The quadriceps femoris. Remember, the quadriceps femoris is first attached to the patella, and then it is attached to the tibial tuberosity. I told you the tibial tuberosity is again very important bony landmark on the tibia. It gives attachment to the quadriceps femoris muscle. So quadriceps femoris first attached to the patella here and then to tibial tuberosity. And this form here, this patellar ligament. Okay, so this is the anterior passing anterior to the joint. So it will do the extension of the knee joint. Similarly, the posterior muscle will do the flexion of the knee joint. Now, apart from the extension and flexion, we also have the medial rotation and the lateral rotation. Why there is a medial rotation? When tomorrow you will go to your lab, try to understand the medial rotation. Why that there is a medial rotation of the tibia and why there is a lateral rotation. So medial rotation is in the last degree of extension, there is a slight medial rotation. And this you will come to know why there is a slight medial rotation. So this medial rotation will lock your joint, and this is called locking of the this is called locking of the knee joint. Similarly, when you try to open, when you try to do the flexion, the first thing will be lateral rotation, and this lateral rotation will unlock your joint. So so you also try to know what is locking and unlocking of the knee joint. When tomorrow you will go to the lab, ask your tutor, I'll be there in the male side, what is locking and unlocking of the knee joint. Locking is the medial rotation, which is done by the quadriceps itself, and unlocking is by is the lateral rotation, which is done by the popliteus muscle. So we'll also come to know what is the popliteus muscle. So this is about the knee joint. And then we have joint of the ankle and the foot. Ankle joint is formed by the lower end of the tibia, lower end of the fibula, and also by the talus. What are the movement? We have only two type of movement. One is called dorsiflexion and one is called plantar flexion. So this is again, these two movements are important. The anterior muscle will do the dorsiflexion. The posterior muscle of the leg will do the plantar flexion. So you have to demonstrate these two movements, perform the dorsiflexion and the plantar flexion of the ankle joint on yourself. So you have to show to your examiner what is dorsiflexion and what is plantar flexion. Now, apart from dorsiflexion and the plantar flexion, we have two another very important movement here in the foot, and that is about inversion and eversion of the foot. So remember, inversion and eversion of the foot are not taking place at the ankle joint. So at what joint? They are taking place at the joint of the foot. Now, what joint of the foot? Now, let's see again. This is your talus and this is calcaneum. So in the posterior part, there is a joint between talus and calcaneum. This is called subtalar joint. Then again, anterior part, there is joint between talus and calcaneum and also between navicular. And this joint is called talo-calcaneo-navicular joint. And this talo-navicular joint is one of the example of ball and socket joint. Head of the talus is like a ball, and navicular, you will see the concavity, which is forming the socket. So this joint is one of the example of ball and socket joint. So this joint is talo-calcaneo-navicular joint. And again, this is the calcaneocuboid joint. Inversion and eversion takes place at subtalar joint and transverse tarsal joint. Now, what is transverse tarsal joint? Transverse tarsal joint is talocalcaneonavicular joint and calcaneocuboid joint. Transverse tarsal joint is talocalcaneonavicular joint and calcaneocuboid joint. So inversion and eversion take place at subtalar and transverse tarsal joint. This you have to demonstrate these two movements, how to do the inversion and eversion of the foot. They'll ask you inversion is when you are lifting your medial border of the foot while the lateral border is on the ground. This is called inversion. Eversion is when you are lifting your lateral border of the foot and the medial border is on the ground. This is called eversion. So these two movement, inversion, eversion, and dorsiflexion and plantar flexion, they'll ask you so many questions about it. First is how to perform this action. Second is what are the muscles which are responsible for these movement. So for dorsiflexion, plantar flexion, anterior compartment muscle, and for a plantar flexion, posterior compartment muscle. Now, inversion will be done by the muscle which is on the medial side, like tibialis anterior and tibialis posterior. Similarly, the eversion will be done by the muscle which are on the lateral side, the peroneus muscle, the peroneus longus, brevis, and peroneus tertius. These all three muscles are everter of the foot. They'll ask you to identify these muscles in the specimen. So I identify the peroneus longus, brevis, and tertius. And the next question will be, what is their action? So you have to say this is eversion. Next question will be, perform the eversion on yourself. Please demonstrate eversion on yourself. So you have to identify the muscles. You have to do the eversion and inversion. And then the next question will be, what is the nerve supply of these muscles? So you have to know all these things. Okay. Next, moving on to ligaments. This we have already discussed about it. So in ankle joint, we have only two ligament. One is medial ligament, which is called deltoid ligament, and one is lateral ligament. So in hip joint, we have five ligaments. In knee joint, we have intracapsular and extracapsular ligament. Now here we have put the medial and lateral menisci. Don't get confused. In some books, say in Gray's Anatomy, they'll only mention two ligament, anterior and posterior cruciate ligament. These are the true ligament. So they mention these two only as intracapsular ligament, but some other book, they also mention the medial menisci and the lateral menisci. For our practical purpose, if it is asked in the exam, you can mention these two also as intracapsular ligament because we are writing this on this lecture also. Now, what are the movement here? This slide is very important and you have to fill this slide, please. Now, what are the movements at the lower limb joint? You have to know the movement. You have to know the muscles which are responsible for producing this movement. And in the skill part, you have to know how to perform this. So how to perform the movement at the hip joint. So what is flexion? Flexion is anterior movement. Extension is posterior movement. Similarly, in the knee joint, you have to know what is flexion extension. And as I told you, what is medial rotation and lateral rotation. Lateral rotation. Similarly, on the ankle joint, only two movement, dorsiflexion and plantar flexion. And subtalar and transverse tarsal joint, we have inversion and eversion of the foot. So you have to know these movement. What are the joints? Like say for inversion and eversion, we have subtalar and transverse tarsal joint. What is inversion? What is eversion? Which muscle will produce the inversion? Which muscle will produce the eversion? This we have already, we touched it, but this is, it's detail is beyond the scope. So you have to know the main muscle at least for each movement. For flexion, iliopsoas muscle, iliacus and psoas major. For extension, gluteus maximus. For abductions, gluteus medius and minimus. For adduction, all the adductor muscle, adductor longus, magnus, brevis, and gracilis. For this will come later. Now, what for the medial rotation and what for the lateral rotation. Then for the knee joint flexion by the anterior compartment muscle, quadriceps femoris. Beg your pardon. For flexion, flexion is the posterior movement of the knee joint. So posterior compartment muscles, the hamstring, they will produce the flexion. Extension is by anterior compartment muscle, that is quadriceps femoris. Medial rotation again by the quadriceps femoris, and lateral rotation is by the popliteus. Similarly, for the dorsiflexion, anterior compartment of the leg muscle, plantar flexion, posterior compartment of the leg muscle. Inversion, the medial muscle, and eversion is by the lateral muscles. Now let's see the muscles which are there for, like, say, thigh. We have three compartment: anterior, medial, and the posterior compartment. So in the anterior compartment, we have uh, we have quadriceps femoris, the major muscles. Then we have iliopsoas and we have sartorius. Sartorius I've already told you. Iliopsoas I've already told you. Now quadriceps femoris. Quadriceps means it has forehead, and those are like rectus femoris and three vasti. So rectus femoris, I have already told you, it is from the posterior inferior iliac spine, and sartorius is from anterior superior iliac spine. So how to identify the rectus femoris? Just go below the sartorius. Just, first identify the anterior superior iliac spine, and below this you will see the rectus femoris. Now three vasti, they take origin from the femur, and their insertion is on the patella. First on the patella, and then from the patella, they form a ligament called patellar ligament, and finally to the tibial tuberosity. This muscle is most important muscle of the lower limb, please. Quadriceps femoris. What are the component of the quadriceps femoris? We have four muscles: rectus femoris and three vasti: vastus lateralis, medialis, and intermedius. And you have to identify all these four muscles in the specimen. Their insertion is on the patella, and then from the patella, they form a ligament called patellar ligament that is attached to the tibial tuberosity. So I told you that tibial tuberosity is a very important bony landmark. So how they'll start the question? They'll give you the tibia, they'll mark the tibial tuberosity, and they'll ask you identify this bony landmark. So you have to say this is tibial tuberosity. The next question is which structure is attached? The patellar ligament. What are the muscles forming this patellar ligament? The quadriceps femoris. What are the component of the quadriceps femoris? Rectus femoris, three vasti. Then they'll ask you to identify these muscle. Then they'll ask you what is the main action of this muscle. This is the main extensor. This is the anterior compartment muscle. So main extensor of the knee joint. What is the nerve supply? All anterior compartment muscles are supplied by the femoral nerve. So this is the complete now about the quadriceps femoris. This you have to know. Then coming to the medial compartment, what muscle we have? We have adductor muscles that I have already told you, adductor longus, magnus brevis. We have the gracilis and obturator externus. This you have to know. Then what we have in the posterior compartment? We have in the posterior compartment, we have the hamstring muscle. Remember this muscle, hamstring muscle. What are the muscles of the hamstring group? The posterior compartment of the thigh is called hamstring region, hamstring muscle. So what muscle we have? We have biceps femoris, and we have semitendinosus and semimembranosus. Now, the semitendinosus and semimembranosus will go to the medial side, and the biceps femoris will go to the lateral side. Okay, where is the origin of all these muscles? These all muscles, the origin is on the ischial tuberosity. I told you the ischial tuberosity is there for the posterior compartment muscle. So this is the origin. Insertion, biceps femoris, I told you it is on the head of the fibula. Semitendinosus, semimembranosus on the medial side. Membranosus on the medial condyle, and tendinosus on the upper shaft of the tibia, medial surface of the upper shaft of the tibia. Now, you can see we have mentioned these two muscles. One is the pectineus and one is the adductor magnus. Now, pectineus, their origin is from the medial side and their insertion is on the anterior side. So this muscle is in between the medial compartment and the anterior compartment. So pectineus, if I say origin is from medial compartment. So what is the origin of the pectineus? This is the pubic bone. And the insertion is on the anterior compartment. So where it is inserted? Just below the iliopsoas. That is just below the lesser trochanter. What is the insertion of the iliopsoas? The lesser trochanter. Again, iliopsoas is also very important muscle. Their origin, it has, what are the muscles of the iliopsoas? Iliacus and psoas major. Iliacus is from the iliac fossa and psoas major is from the body and the transverse process of the lumbar vertebra. And in the insertion is on the lesser trochanter. So identify these two muscles. You have to identify the iliacus and psoas major. You have to identify their insertion of the lesser trochanter, and you have to name their action, the nerve supply. And just below the iliopsoas, you will get the pectineus. Now, similarly, adductor magnus is a muscle of the medial compartment, but some part of it is going to the posterior compartment. So we see adductor magnus has two parts. One is the adductor part that is on the medial compartment, and one is the hamstring part, which is on the posterior compartment. So the hamstring part of the adductor magnus again will take origin from the ischial tuberosity. So it has two parts. Now, fascia. So this is the muscles of the thigh and the gluteal region. Thigh, again, we have anterior compartment, medial compartment, posterior compartment, and the gluteal region, which is just above the posterior compartment of the thigh. These are the muscles of the thigh and their nerve supply. The anterior compartment by the femoral nerve, except the psoas major muscle, because it is coming from the posterior compartment, posterior wall of the abdomen. So this nerve supply is from the lumbar plexus. The medial compartment is all supplied by the obturator nerve, except the hamstring part, which is supplied by the tibial part of the sciatic nerve. And the posterior compartment is by the tibial part of the sciatic nerve, except the short head of the bicep, which is supplied by the peroneal nerve. So the posterior compartment is by the sciatic nerve, the medial compartment is by the obturator nerve, and the anterior compartment is by the femoral nerve, with one exception in each. The femoral triangle. This also they ask you um, what is the boundaries of the femoral triangle, how it is formed laterally, medially, what are the content, and what structure is forming the floor. Now here is the floor. If you see the floor, go tomorrow and see the floor again. We have the anterior compartment muscle coming, iliacus, psoas major. Then we have just below the iliacus and psoas major, we have the pectineus, as I told you, and then we have the adductor longus, and this laterally it is formed by sartorius, and medially it is formed by the adductor longus. So these four muscles are forming the floor of the femoral triangle. So you have to know, you have to remember it, you have to identify this. Content is all femoral structures with deep inguinal limb and femoral sheath. This is about the femoral triangle. Adductor canal. From the apex of the femoral triangle, we have a canal, and this canal is called adductor canal. I think all of you have seen it. They'll ask you how this adductor canal is formed. So laterally, it is formed by the vastus medialis, above by sartorius, and below by adductor longus magnus. What content we have? All content of the femoral triangle except femoral nerve. We have here, we have artery, vein, saphenous nerve, and nerve to vastus medialis. So they might ask you the content of the femoral triangle or the content of the adductor canal. So here you will not get the femoral nerve, only femoral artery and femoral vein. Saphenous nerve is a branch of the femoral nerve, but no femoral nerve here. This is the muscles of the gluteal region. The main muscles are gluteus muscle that we call as gluteus maximus, medius minimus, tensor fasciae lata. Has are the lateral rotator of the thigh. What are the short muscles? The piriformis, superior inferior gemellus, obturator internus, and quadratus femoris. These muscles are attached to the greater trochanter, the superior border of the greater trochanter, and they all are the lateral rotator of the thigh. So again, how they might ask you, name the short gluteal muscles. So you have to name piriformis and superior inferior gemelli, obturator internus, and quadratus femoris. This is the one question. Name the lateral rotators of the thigh. So again, the same answer. Name the muscles which are attached to the superior margin of the greater trochanter or the greater trochanter. Again, you have to name all these muscles. So these are the short muscles. How to see the short muscle? You have to remove the gluteus muscles. And then once you remove the gluteus muscle, you will get the short muscles. Now coming to the leg. We have again how many compartment we have? We have three compartment, but no medial compartment. We have the lateral compartment, anterior posterior compartment, and the lateral compartment. Anterior compartment are extensor muscle because these are the dorsiflexion or the extension, plantar flexion or the flexion. So compartment are extensor muscle, and you will get anterior tibial artery and deep peroneal nerve. Lateral compartment is the peroneus compartment. We have peroneus longus and brevis, and these are everters. Anterior compartment are extensor, lateral compartment are everter, and the posterior compartment are flexor. Now see these are the muscles of the leg. Anterior compartment are extensor muscle. The most medial is tibialis anterior. Then we have extensor hallucis longus, digitorum longus, peroneus tertius. Nerve supply is by deep peroneal nerve. The lateral compartment we have peroneus longus brevis. Nerve supply is superficial peroneal nerve. Posterior compartment we have two groups. The superficial group are gastrocnemius soleus plantaris, and this is called calf muscle. And this is attached to the posterior tubercle of the calcaneum through the tendo achelis. Deep group we have popliteus and the flexor hallucis longus, flexor digitorum longus, and tibialis posterior. It is the the flexor compartment, like anterior compartment is the extensor compartment. Deep group of the posterior compartment is the flexor compartment. We have here flexor hallucis longus, flexor digitorum longus, and tibialis posterior. Nerve supply is tibial nerve. Muscles of the sole of the foot. This we don't ask in the OSCE exam, but you have to just remember how many layer we have and what are the muscles in the different layer. In the first layer, we have a flexor between two abductors. What is a flexor? Flexor digitorum brevis, and two abductors are one on the medial side, abductor hallucis, one on the lateral side, abductor digiti minimi. Second layer, we have the lumbricals. Third layer, we have an adductor between two flexor. What are the adductor? Adductor hallucis. And what are the flexor? Flexor digiti minimi brevi on the lateral side and flexor hallucis brevis on the medial side. Fourth layer, we have introitiae, dorsal introitiae, plantar introitiae, and two tendon, that is peroneus longus and tibialis posterior. This is about the muscle. Now, which is the main artery? Main artery of the lower limb is the femoral artery. And it is continuation of what? The external iliac artery. And this is the ligament. This is the inguinal ligament from anterior superior spine to the pubic tubercle. And then it's become the femoral artery. So what are the branches here in the femoral artery? You have to know. And it passes from anterior to posterior. Then it comes to the popliteal fossa here. It becomes the popliteal artery. So again, the popliteal artery is the continuation of the femoral artery. And then just below the popliteal artery, it divides into anterior and posterior tibial artery. Anterior tibial artery goes anterior compartment. Posterior tibial artery go to the posterior compartment, and at the bottom, tibial artery continues as the dorsalis pedis artery. This is again very important because this we use for the peripheral pulse. Dorsalis pedis artery, which is continuation of the anterior tibial artery. Veins of the lower limb. We have two set of vein. One is superficial vein, one is deep vein. Superficial vein, we have the great saphenous vein and the small saphenous vein. These are important questions. The great and small saphenous vein. The great saphenous vein is from the medial side of the dorsal venous arch, same like upper leg. Then it passes on the medial side of the leg and the thigh, and finally drains in the femoral vein. The small saphenous vein is on the lateral side of the dorsal venous arch, is passes on the laterally, and then finally it drains in the popliteal vein here, in the popliteal fossa. So this is a small because this is draining in the popliteal vein in the popliteal fossa. This is great because it is draining in the femoral vein in the femoral triangle. So we have three nerves, and we have already discussed about these things. The femoral nerve, which is branch of the lumbar plexus, and it supplies the muscle of the anterior compartment of the thigh. And then we have sciatic nerve, which is having two division, the tibial and common peroneal nerve. The tibial nerve supply all, you know, All the posterior compartment, common peroneal nerve supply the lateral and anterior compartment, and the sciatic nerve supply the posterior compartment of the thigh. So this is what we have for the sciatic nerve. This is important again, and you have to identify the sciatic nerve. You can see this is the piriform muscle, and just below the piriforms, this is the nerve, the thickest nerve of the body coming from here, and this is your sciatic nerve. Obturator nerve again is a branch coming from the lumbar plexus. This is anterior division of the ventral MI L2-4, and it supplies the muscles of the medial compartment of the thigh. So this is all. This is just 28 to 27 slides, but this is just the guidelines for you to read from the workbook and also from the gate 1, 2, 3, 4, so that you can try to understand whatever how the questions are asked in the lower limb, and what kind of question may be asked in your MCQ and MEQ. So these are the important thing which just now I finished. If you want to ask anything, you can ask. Is there any question?
Doctor, I have a question
Yeah.
about asking, if possible.
Yes, please.
We have a station about pharmacology, right? Can you give us idea about it?
Uh, Pharmacology.
Yes,
Okay.
pharmacology.
You're asking about the OSCE station of the pharmacology, right?
Yes. Can you give us an idea
Yeah.
about
So
it?
you have been you have been given one a lab about the drug dilution that you remember, right?
I'm sorry, what?
Is it given? We have one practical about the drug dilution given
No,
by
no,
Dr. Farazdak.
it's
Is
on
it?
Wednesday.
Is it given to you or not?
I think
The
not.
drug dilution. You know
No,
how to
no.
calculate the drug. No. Okay. Okay. Let us finalize on this. What question? Actually, this is about the drug dilutions and how to calculate, and it's all about the calculation. So I'll talk to Dr. Farazdak or the physiology department to give us what actually this station is for this time. If it is not given to you, we'll make one lecture about it or one revision class about this lecture, and then we'll let you know. This is a simple station. This is mostly about the calculation, how to calculate it. So we will provide you with one revision lecture about this. Don't worry about this. We'll let you know the skill list. Also, what we are going to ask you in this station, a physiology and pharmacological station. Okay.
Okay, thank you.
But yeah, anybody else? Okay, thank you all. So um, I have received from you some questions which are uh, raised by you. There is some confusion or whatever. So I've sent it to the exam committee with your uh, you know valuable inputs that you have given for the each question. By today or by tomorrow, we'll be knowing that what are the questions there, and we'll let you know, inshallah, hopefully. And then by the end of this week, we'll try to release your quiz 2 result, hopefully, inshallah. And then at the
Doctor?
same time, we are going to. Yes, please.
Sorry. Continue.
You want to ask anything?
Yeah, no, I just wanted to say, for the final exam, if one of the questions has a CT picture or radiology, can you make sure that the picture is clear? Because the picture that we
Yeah.
received,
Will
especially on the female side, I think
we,
the picture on the male side and the
yeah.
female side is different. Can you just make sure for the future that the picture is clear,
I will
or
ask
avoid putting the
the
picture?
exam committee to consider. Yeah. No. We printed it, but I have explained the picture. internally I explained, I didn't ask anybody. I personally, so the picture was clear in the mail site for all of the students. Still, we will send your request that the picture was not clear and it was not told to you that what the picture is. So it was some kind of confusion for you in the female side. So I have already submitted the same request which you have sent to me, that this is the problem in the female side. So they're going to have this, like, say, whatever they'll decide, I'll let you know in Java.
Okay, thank you.
Doctor, if they can print the CT on an entire A4 paper, just for the CT, so it can be clear to us in the final exam.
Yeah, if it is like this, I'll not put any picture like this, because if there is any picture, there'll be some kind of confusion, because in the exam, it's when you are having the exam, you're little already confused. You're very, I mean, you want everything to be very clear. So uh, I'll not, suggest them to put any picture further in the coming exam. Hopefully, in MCQ and MEQ exam. If it is like OSCE exam, we used to print color picture, and we put it in the OSCE, and that too from your lecture or from the workbook. But if it is like this black and white picture in your the MCQ and MEQ, I will not suggest them to put it. Okay.
Okay, doctor.
Okay. With this, I'll finish and I'll come back to you again. We'll have one more session regarding your OSCE. I'll give you the details, the blueprint, the skill list, everything regarding your OSCE exam. So just start reading for your final exam now. We are just 2 weeks for your case 9-10 and then 2 weeks again. And as you have sent me this dates, the probable dates which you have, which you want for the exam, I have just received one message from one of you, and this is uh, this you want the MCQ, MEQ on 3rd and 4th OSCE. Okay, MCQ you want on 5th. On 7th, that is on Thursday.